Hello, everyone. Thank you for joining me. My name is Anthony Hutcherson and the Winn Feline Foundation as we present Pursuing FIP and Winning, What We Know Today. Now, this session today is a culmination of a lot of work and is the summary of the symposium held in November 2019 at the University of California, Davis. Joining me today are several members of our esteemed board of directors at the Winn Feline Foundation. Dr. Glenn Ola, veterinarian, Dr. Vicki Thayer, a veterinarian, and Dr. Drew Wagner, another veterinarian who's also Winn Feline Foundation's president. So this morning, what we're going to see are some fantastic summarizations. We're going to spend about 90 minutes or so talking about what has occurred in FIP. What is it? How was the disease discovered, and how does it progress? We call that pathogenesis. And then we're going to look at what are the current treatment methods, and how do you live with FIP in a multi-cat household. Finally, we're going to discuss prevention methods, and that's going to be done by Winn's president, Dr. Drew Wagner. But we can't go any further without thanking the sponsors of this incredible event. There we go. This fantastic seminar today, which is sponsored by Dr. Elsie's. Dr. Elsie's makes some fantastic cat litter and some cat food, both dry and wet. And Winn Feline Foundation exists because of the incredible care of two of the world's greatest cat organizations, the Cat Fanciers Association and the International Cat Association. We're going to talk a little bit about, a little later, about how Winn even began, and it all started with the Cat Fanciers Association. Now, I want to remind you that we've got a special engagement today, that you feel free to connect with us. Text CAT, C-A-T-S, to 833-985-2287 to donate to the Brio Fund, which supports FIP research and treatment. And many of the things that we talk about, the breakthroughs today, are as a result of donations to the Brio Fund. Also, just in case, this is a lot of information. In case you don't get it all, you can go right to winn.org, W-I-N-N.org, and download the summary document, which summarizes all the things that we talk about today and everything that was covered at the symposium. This document is interesting and visual, but also has all of the detailed information to share with your veterinarian. So you can donate directly to the Brio Fund, and we have a really generous, I see here, a generous supporter who is willing to sponsor, to match funds of up to $5,000. So however much we get over the next 90 minutes, he or she will match that up to $5,000. We have 90 minutes that we're going to cover everything today, and that goes through our session today, all of the stuff that I just mentioned about FIP origin and development, diagnosis, treatment options, prevention, and prognosis. Now, we have a lot to cover, but we do take questions, and you can email us at FIP@winnfelinefoundation.org. Again, we have this incredible anonymous donator who's willing to match up to $5,000 in funds that we get today during these next 90 minutes. If you text CATS to 833-985-2287 and donate directly to the Brio Fund. Now, I've talked enough. Let's hear all about the details of what is FIP, feline enteric coronavirus. How is that related to all the other coronaviruses we're hearing? Let's find out how this affects every cat every day and who gets to enjoy the benefits from the Winn Feline Foundation. That's pretty much every cat. So Dr. Ola, are you there? We're going to move on to you and have you explain everything to us in a way that only you can. Sum it up for us, Doc.
Yeah, thanks, Anthony. Can you guys hear me okay? Yeah, good. You know, I've noticed, Anthony, you got my name on the bottom because the way you logged in, but that's Anthony Hutchinson's, folks, not double me, two different people. Okay,
it's who I want to be.
Right. Okay, so there's a bit of a delay. Do I have control of the slides?
No, I do.
Can you please let me have control, and then I'll go ahead and go through this because we're a little behind on where the slides should be, and I can catch us up.
See if you've got the right one.
I think I got something jumping around, but we'll get there. Sorry guys for this little delay here, just technical thing. Here we go. I'm going to go forward here. At least I think I am. So this is just a go between. Nice faces, huh? Everybody, I love this picture because you can look there and say which one is your cat, right? So this is sort of a cool picture. But let's just move on. I'm glad to be here. I would say good morning. It's morning where I'm at, but I'm sure if attendees are from around the world, you know, I don't know what time of day it is, but you know, maybe in the middle of the night. So hopefully you can stay awake. But thank you for joining us. I've been a board member associated with Winn for the last 10 or so years. And I live in Albuquerque, New Mexico. So we're a small, one of the less populated states. So, you know, as far as COVID-19 and all of these kind of things going on, we're sort of always behind on whatever's going on in the rest of the United States. Anyway, so things haven't hit us hard here, but we still have the lockdown going on like other places in the world. So again, I'm glad to be here. And I just want to also thank Dr. Elsie, TICA, CFA for sponsoring this webinar to try to, you know, update people on where we are with FIP, feline coronavirus. Let's see, let me go ahead and forward this. Just a little heads up of what we're talking about today. So, you know, there's different aspects of disease conditions that are important to look at. Whether you're looking at something like FIP, to understand the biology, the origins, not just the origins in, you know, where it came from and wound up infecting cats, but also sort of a historical origins of FIP is informative, in my opinion, to how we got to this point where we could have this symposium this past year, where actually a cure has been found for this deadly disease. So I'll just be talking about actually two of these 4 topics: the biology, virology, pathology, and the diagnostics. And then Dr. Wigner and Dr. Thayer, they'll cover prevention, treatment, etc. Okay, let's go forward. So here, this. Yeah, the big there, right? But I think people probably do understand this. But here I also bring this slide up, and you'll see other pictures here of, you know, it's the coronavirus, and it's interesting. I would have said when I presented this slide up to a year ago or so, I would say maybe 50% of the people would say, oh, it's a coronavirus. But I think with the COVID-19 thing going on, the pandemic, everybody probably knows now. It's like, oh yeah, it's this virus, sort of round, it's got these spikes. It looks like, you know, like a little corona star thing. So, you know, so this is sort of a cartoonish image of the coronavirus, and these are micrograms. You'll see some other pictures, some higher quality, some less high quality pictures where you see the little spikes here, which defines this particular family of viruses. So these viruses, they're in the Coronaviridae family, there actually is 4 genuses, and alpha, beta, gamma, delta. And actually the feline coronavirus, there's 3 different viruses that are in the alpha coronavirus, and that does not include the COVID-19. That's a beta coronavirus, as is SARS and MERS. But anyways, the alpha coronaviruses, there's one in dogs, there's the one in cats, one in pigs. Okay, so that's sort of defines that particular genus group. Anyways, so as far as FIP goes, I found this reference, and this is like one of the original descriptions of FIP by Jean Holsworth. She was at University of California. She was at Angel Memorial Hospital in Boston. Here, let me update this over here. Sorry, folks. If you see what I have highlighted here, you know, it's a lot to read there, but bottom line is it's like a perfect description of what we see when we see a wet form type of FIP. So she described that back in 1963. So you can see this has been around, or we've been aware of something that presents like this that we now define as FIP in cats for the last 57 years. So it's quite a long time. So there's a lot of history starting from that time frame, trying to sort out what's causing this condition in cats. When did it show up in cats? And what, you know, and up to the future, what we know about this virus. So back then in 63, they knew it seemed to be infectious, but they didn't know it was a virus. They didn't know it was a coronavirus, much less anything else. But anyways, let me go slide forward again. Sorry for the delay on the slide. They should go forward. So let me stay here just for a second, because now this was 1963, and they're in interim through the 60s, the next 7 to 10 years. One group actually finally said, oh, we think this is a virus that's causing this, but still didn't know it's a coronavirus. That was made by Wolf and Grismer from Ohio State. And then finally, somebody took a picture of it, some other researchers now around 1968 in this range, and they still didn't know it was a coronavirus. They're saying, well, now we have a picture of it. It's definitely a virus. We confirmed that. And then Gerald Ward at UC Davis finally got this image. This is the actual original image. So you can see maybe back then electron micrographs weren't quite as high quality the way they are now, but still, regardless, you can see, like here where I'm circling this here, you can see the arrow pointing. You can see the little spikes, suggestive of coronavirus or a coronavirus of some sort. Still not defined as an alpha coronavirus or that kind of depth of definition of the virus at this point. But you can see it's not just a fast process, like you're seeing everything going with COVID-19, and from start to finish, how much we've already learned about this virus, that particular virus, even though there's still a long ways to go. This was over almost a decade before we figured this out. To get to this point that we figured out that it's a coronavirus. So any event like 1972, then it's where all of a sudden the distinction between two different presentations of the coronavirus was suggested or shown, and that's the dry form, which you probably heard of, and the wet form. And in my opinion, you know, that's sort of black and white, because my experience as a veterinarian, I've seen it in between, that it's primarily a dry form, but there could be a little bit of a wet form part of it, and you might find some really minuscule pockets in this horrendous fluid buildup that you might see in some of these kittens. So you know, there's a range of in between, and from what I've seen. So anyways, through the 70s, I think it was by 1978, Dr. Peterson, okay, believe it or not, he was involved already working on FIP as early as 1964, so as a veterinary student, and actually published in the late 60s on FIP, but kept his interest, thankfully, because he's made some major breakthroughs in understanding this particular pathogen. So he actually showed a connection between the transmissible gastroenteritis virus, which is the coronavirus that infects pigs, and the canine coronavirus. And that's, you know, a grouping into what's called the alpha coronavirus. And I said before, which is a different genus than the COVID or the SARS or the MERS. You know, so now they're grouping these viruses together in this group, and there could be a historical question trying to be answered, because if you look in the history of the FIP, there really wasn't much to suggest that this disease process existed before, let's say, roughly the 1950s in cats. So there might have been one description back in 1912 by a researcher named Jacobs, but you can't really confirm that was truly an FIP description, because some other disease processes can cause, you know, fluid buildup in the belly of cats, not just FIP. In any event, so something changed. Something seems to be different in the 1950s, 60s, and you can think about it, there's three possibilities of the change. One is that there was a mutation in the coronavirus in the cat that seemed to be more conducive to that a particular variant that normally would just cause a little diarrhea, but now it's more prone to actually do this mutation that can lead to FIP in some cats. So that's a possibility. It's possible that this virus, as you've seen with COVID-19, with SARS, with MERS, that you have a species jump of the virus from one species to the others. So an event like that could have happened. Then the question, which is a guessing game, is where did it jump? If it did jump into cats and lead to coronavirus in cats, which can develop FIP, what was that species? Was it a bat? Maybe, probably not, but maybe, because bats have many coronaviruses. But one thing to keep in mind is transmissible cell gastroenteritis in pigs actually didn't jump on the scene until like a decade before cats. So it's possible that the pig variant jumped into the cat and led to the cat feline coronavirus, and all this transpiring in the 1950s and 60s. And I think one of the biggest probably reasons for this virus to pop up on the scene in cats in that time frame is think of what happened. End of World War II. All of a sudden, cats aren't just barn cats anymore. Cats are actually family members, and then there's breeding societies, and cats have a different role in our daily lives. And now there's feral cat colonies are starting to show up, and shelters are starting to show up, and an increase in the number of cats. So their environment has changed. They're more crowded, sharing litter boxes, and it could enhance this fecal-oral route. That's the normal transmission of the enteric form of the coronavirus. So there was an environmental change that may have been much more conducive for propagating coronavirus. Let's say the enteric coronavirus, which can then, if it gives if there's enough chance, it can mutate into the virulent form, the FIP form. So let's move on. I think the next thing I have here is just a picture of one of my patients a year or so ago. This was Cassie. So here's a young cat. This is the typical presentation of the wet form, okay? So you can see it, this poor kitty, she was so nervous. You can see it's like, what are you doing with me? But you can see the big bloated belly full of fluid. And it's amazing to me, still, I have to admit, it's amazing to me that you'll get different answers to people say, oh, the cat, what can cause this in a cat? Oh, the cat probably has parasites. It's okay, just need to deworm it. Or, oh, this kitty just ate a lot of food and it's just got a full belly. No, look at this. This looks like a bowling pin, right? I mean, this is quite abnormal, full of fluid in this belly. This is definitely a classic wet form FIP. So let's move on here. So what I'm going to just try to talk about, and hopefully not bore you with this, is some of the factors that we've learned over the years, in the last 57 years since this virus has popped up on the scene, that we find important, at least important factors that seem to lead to FIP in some cats, not all cats. Let's say 5 to 10% of cats exposed to the enteric form of coronavirus can or may develop FIP. So there's viral factors, and I'll spend a little time on that and try not to be too technical on that, on some things we learned. And I can tell you a lot of this work was done, let's say in the 1990s in particular, actually when they started being able to, at least the type 2, the serotype 2 coronavirus, which is the type that's actually can be grown in a petri dish, basically, in the 1980s and forward, allowed avenue for actually studying the virus, at least the serotype 2, if you believe that that's clinically significant. Some don't, but there obviously must be some clinical significance to that. But anyways, through the 90s, development of what's called internal mutation theory, etc. So anyways, I'll talk about that. Host factors, I think, are more important than you'll realize. Host factors are an appropriate immune response of any one cat. Their genetic makeup, their immune system, how it's functioning when exposed to a virus, the enteric, let's say the enteric form of the coronavirus. The age of the cat becomes important. Concurrent diseases that might immunosuppress the cat, for instance, like a retroviral infection on top of a coronaviral infection. You know, there could be immunosuppressions or lead to dysfunction of the immune system in a particular host. And then, as I sort of mentioned earlier, things changed after World War II when cats became pets. That you have environmental factors, stressors, early castration, multi-cat households, shelters, whatever, you know, things that actually have changed, had changed in the 1950s, 60s, and onward. Okay, let's move on here. Okay, so a little verbiage here, but let me tell you, give you an idea. This sort of fits one of the theories that popped up that was put forth by Dr. Peterson at UC Davis, which is called internal mutation theory. And most studies do support that theory. I mean, there's been in the last few years some publications that suggest, well, maybe it's not quite right, but then that evidence isn't quite as strong, and it still seems to be the most likely explanation for what's going on with this virus. But basically, most cats are exposed to the enteric form of coronavirus sometime in their lives, usually when they're kittens or in a multi-cat or you know, a multi-cat type environment, whether it's shelter or somebody's house or a cattery or whatever. And in the last few years, what they've actually identified, let's see, let me point down here, spike proteins. I'll get to that a little bit, but let's say not in the last few years, but the last few years, last 10, 15, 20 years, that kind of last few years, they've shown that there's a mutation or something that changes the affinity of the coronavirus for the enterocytes, which are the gut cells, for macrophages, which are cells that are involved in the immune system. There can be an antigenic presenting cell of some sort, but that's how they gain access to the rest of the body. But what's not highlighted here is, like, so before you can develop FIP, it has to move on beyond the gut. It has to move on beyond that. So that's a necessary step, but it's not sufficient. So what's been shown in the last few years, I'd say less than the last 10 years, but last 5 to 8 years or so, is that surprisingly, cats that do not develop FIP can actually have systemic spread of the coronavirus. In other words, already access to the macrophage and other parts of the body, but they don't develop FIP. All right, so that complicates things, right? So what that basically is saying is that that's only one of the steps. It's more complex than that. So something else is, you know, if there are viral factors, something else has to be happening, a different mutation, other mutations, besides just changing their host cells that they're targeting, in this case, flipping from enterocytes to macrophages. So here, this is important to think about with these large viruses. The way to look at a coronavirus, it's a single-stranded, positive sense RNA virus. It's a huge virus, one of the largest viruses in nature, and it's got like a sloppy RNA polymerase or replication apparatus, right? It's sort of sloppy, so it's prone for mutations. So let's say the normal route of enteric virus infection is the gastrointestinal route, you know, gastrointestinal route cycle. In other words, cats that share litter boxes, that's where you're going to pick it up from. Let's say a chronic shedder, you know, they share a litter box, then they ingest the virus, and then they can get infected, etc. But they can have, let's say, multiple variants of the enteric form of the virus in their excretions, for example. But then every now and then there can be a mutation that gains access to the macrophages, and it actually, early on, what they've shown that these mutations involve one of the primary proteins, a non-structural protein, is the 3C gene. So this gene, for efficient gut infection, enterocyte infection, needs to be intact, all right? So if you lose this gene, if there's a mutation in this gene, it's truncated, it becomes non-synchronous, so even though it might be the right size of the product, but it's sort of messed up because it has multiple mutations and not quite the right structure or whatever, then those are the variants of the coronavirus that gain access to the macrophage, all right? The other gene that early on was shown that was suspected to be important in developing FIP was the 7B gene, and it's a gene that's involved in virulence, that it makes these kitties, when this gene's intact, then it seems like there's a high virulence. But it turns out that both the FIP or let's say coronavirus that's systemic, that's gains access to the rest of the body, have intact 7Bs as well as the enterics have intact 7Bs. So it's possible, this idea is that the 3C gene, which is intact in enteric form, suppresses the virulence of the 7B form. And now you can think of it this way. Now let's say we lose the 3C gene, gain access to the rest of the body, that unmasks the virulence of the 7B. So the 7B gene, right? So then you can see that you might have enhanced virulence, a tendency for this virus now to make the cats sick. Okay, now in the last few years, I know it's sort of long-winded, so these were things looked at for the last 10, 15 years. Now in the last 5 years or so, we're looking at the S protein spikes. Remember the spikes on the coronavirus? The spikes are what is needed for the virus to recognize its receptor site, okay? In other words, the cell that it's going to infect, that is determined by the spike protein. And not only that, this region there's a fusion region in this area. It also, once it binds to the receptor site, there has to be an event called a cleavage event, and then it can merge with the membrane and be internalized into the cell and thus infect that cell. So what's been shown in the last few years is there's particular mutations in the spike protein that seem to lead to the preference of infecting enterocytes as opposed to macrophages. Two in particular were identified in the early 2010s. It was an M1058 to an L, as S1060 to an alanine to an A. But anyways, it's not in all cells that do that, but keep in mind, that's still not sufficient to develop FIP, right? Because that means now we go to macrophages, but doesn't mean the cat's going to develop FIP. But a lot of the cats that do develop FIP have these particular mutations, but not all. The other thing that I find interesting when I review this history and stuff is that, you know, what is the receptor site of these coronaviruses in cats? And believe it or not, this is going to be surprising because it surprised me. Is we know the receptor site for the serotype 2. All right, that's the one type of coronavirus that's floating around in the cat population. That's the minority. Let's say it makes up maybe 20%. But they know the receptor site for that. That's the aminopeptidase and is the receptor site. Other common receptor sites for coronavirus are like the ACE2, and that's actually what the COVID-19 binds to. But again, that's a beta coronavirus, different. But some alpha coronaviruses may use some other sites like that. The point is the serotype 1 coronavirus in cats, which is the primary one, we don't know what the receptor site is. It's unknown to this day. 57 years later, there's things we need to learn about this particular virus. I find that fascinating. So, but that's just the way it is. Okay, just one last note about the spike protein is that I know from work from Dr. Whitaker's group at Cornell, they've shown some mutations in what's called the S1, S2 region, which is where a cleavage site happens. A cleavage site means there needs to be broken apart for the next step in a viral cycle, which is to infect the cell. That's important to remember, okay? And I'll tell you why in a second, and something that Dr. Thayer will go over probably a little bit in a minute. Let me see if I can advance this slide. And you know what, I have verbalized a lot of this stuff. I think the main thing I wanted to just point out here is that, you know, you have these this is the, you know, the coronavirus in a linear form. It's about 29,000 Daltons long, nucleotides long. It's got 11 different reading frames, so proteins that it produces. These ORF1, ORF2, believe it or not, these are one of the primary sites that distinguish some of the genuses of the different coronavirus, the alpha, beta, gamma, delta. You know, I can tell you that the three in the alpha group, the pig one, the dog one, the cat one, these are pretty well conserved. Here's the spike route, the spike location, that's important. M is for membrane-bound nucleoside type, and here's another accessory, and B form, which is that virulent factor. So you can see that, and then there's a little schematic of the coronavirus. So just to give you another presentation of how to look at the coronavirus. Here, let's go forward. Okay, this is the last slide regarding some of the virulence factors related to the virus. I think the main thing here, and I won't spend a lot of time here, I know it's a lot of words, but the point is, here's a virus comes in, it's got to find its receptor, there's got to be a cleavage event before it can enter in. The reason that's important is because there is a drug coming out on the market, GC376, that does show efficacy against the feline coronavirus, the FIP. It's a 3C-like protease inhibitor, so that's actually being tested, and that shows efficacy. And if you look down here in this whole list, think about this. These are all targets which we can target with antiviral drugs eventually at some point that can probably be part of the treatment in the future against the FIP. The one, the GS441524, which people are aware of, that actually targets, it's a nucleoside analog, which actually interferes with this RNA polymerase. But Dr. Thayer will cover some more of that. But just wanted to just be pre-warned that there's a lot of different things we can start looking at. It's almost like Mount Everest, right? The first person who did it, that's a major feat. Now everybody's going up it. So now we know that this works here. We know this works here. We'll find other drugs that actually, maybe a cocktail will be what's going to be the future to get these cats cured. Let's move on. So I wanted to interject some of these pictures in here. This is another patient I had, Mr. Cosmo. He was like I think he was 6 or 7 month old Bengal, and this is a neurological form. So this cat twitching, malaise, despondent, probably neurologic. I'm not sure how much he was there mentally. Overnight, acutely blind. You can see the dilated pupils. He just went blind, but this was confirmed to be a neurologic FIP. So this poor kitty. So just to see, these are things I've seen. This, I see maybe 4 or 5 FIP type cases per year, that kind of frequency. So let's move on. Okay, so this I think is important. I think you can't underestimate what the host factors are that leads to a kitty that will develop FIP. Here's another wet form, right? No, he didn't overeat. No, he doesn't have parasites. He's got a belly full of fluid, right? But anyways, to make things simple, as far as host factors, we look at the immune system, and to make it simple, just make a dichotomy of there's a humoral response and there's a cell-mediated response. Humoral response means sort of the antibodies responding to external invaders of some sort, like bacteria is typical, that kind of stuff. Cell-mediated, usually that's addressing things like viruses, which are intercellular, in this case, enterocytes, macrophages, etc. And different immune responses have different production of cytokine production, which are the signaling cells during the immune response, which are important. Major histocompatibility complexes, those are on every nucleated cell, I guess. So at least the MHC1s, and then you have what are called antigenic presenting cells, and MHC2s, etc. I won't get into that. Effects on the life cycle of the lymphocytes, its importance, how we clear the virus, etc. So the bottom line is, what I want you to take away from here is that the immune system functionality is extremely important in these cats, whether they're going to develop FIP or not. Even if they get systemic coronavirus, will they develop FIP or not? One of the problems with the humoral response, and actually with any vaccine development, so you hear like the COVID-19, bringing that back on board because everybody's so aware of this, is that develop a vaccine, you have to make sure that the vaccine's safe, especially for a crazy virus like a coronavirus, because they can actually make the disease worse if it's not shown to be safe in the first place by a condition called antibody enhancement. And that is what's thought probably leading to a big problem when a cat is dominated by the humoral response. In other words, when a cat has a viral infection, there's a balance between a humoral immune response and a cell-mediated response. And I think the imbalance in the cats that develop FIP seems to switch towards the humoral response, which is inappropriate. All right. And then what you'll see is that let's say that it's still not a perfect response, but a cat genetically, the way its immune system's made up, that it has some T cell response, then it could be a partial response. So those will be the cats that probably develop the dry form of the FIP that you may be aware of, as opposed to with cats that only develop a humoral response, which are the cats that develop a wet form of the FIP. Okay. So anyway, so there's still an exaggerated humoral response when it's not quite enough of the T cell response. Again, it's pretty complex. The cytokine production. I mean, it's like pretty complex on what cytokines and signaling cells that are produced. And of course, again, everything depends on the virus, the host, the stress of the environment, and I think a combination of all these factors leading to whether a cat's going to develop FIP. Let's see, let's go forward again. This is important. Oops, sorry, let me go back before I get to this kitty. This is important in my opinion, and let you start thinking about this. So not me, but the genome for the cat was first presented back in 2007 from an Abyssinian cat named Cinnamon, and that was Dr. Lyons. She's now actually she's at Missouri now, I think, right? She's not at UC Davis anymore. Anyways, I'm sorry if I forgot that, but anyways, let me move on. The thing is, through the last 20 years or so, there's always been showed breed predilections in this, pure breed predilections, and it's not really clear, it's a breed per se that's more prone to develop FIP. It could be a lineage within a particular breed, but what you'll see is that this study down here by Peterson sort of sheds light on that. So, but before I get to that, let me just tell you that, the simplest thing to look at first genetically, as far as host factors and genetic makeup of the cats is, can you identify, let's say, a single gene that say, oh, cats who have this gene will develop FIP? Well, no, sorry, not so simple. There's at least 5 candidate genes that were identified in one study in 2013. But the study that in 2016 by Peterson that I think is very interesting is that he's saying, okay, if there's a genetic, and the thinking here is, if there's a genetic predilection to develop FIP, then what if we selectively breed cats that are resistant to FIP? And so they did this, amazing, over generations. And what they found is that even though they select for what looks like should be selecting for cats with resistance to FIP, they actually wound up cats that were more susceptible to FIP. And it sounds counterintuitive, and it is sort of counterintuitive. But the idea is that what's going on is there's an immune homogeneity that's being selected for and loss of immune heterogeneity. So these cats have more of a dysfunctional immune system because of suspect immune homogeneities dominating the picture. So they just don't have a robust immune system. So I can see that you might have a breed predilection per se. If you have a breed, let's say Burmese, not to pick on Burmese or anything, or Burman, if they have don't have a pretty robust immune heterogeneity within that breed, for example. It means that we want more heterogeneity and they need to outsource, breeding within the breed, et cetera, to keep those cats healthy and from getting FIP. So I find that study by Peterson in 2016 quite fascinating. Let's move on. I think I have another picture of, here's another one of my patients. So this I want to point out two things in this picture from this patient. This is Miss Tabitha. One, she's older. It doesn't always have to be kittens under 2 years old that wind up with FIP. This kitty was about 12 years old. Typical history is, oh, here's an old kitty. They lost another old kitty. They introduced a new kitten in the household. Who knows? The kitten brings stress, right? The kitten may bring enteric coronavirus, all sorts of things. But if you look closely at this kitty, she has different sized pupils. She actually has uveitis in this side. So this is another variant of the dry form. So she's got uveitis, some neurological symptoms as well. but unfortunately, this kitty was confirmed FIP positive. And so, you know, you keep an open mind that there might be a second wave of cats, older cats, you know, with certain environmental stressors and environments that actually can also develop FIP, even though they're not the primary target, which are the younger cats under 2 years old. And let me see if I have one or two more. Sorry, it's taken a while to get through this. The diagnostics won't take very long, so I'm going to just talk briefly about the diagnostics here. But I think I can give you a big enough picture on what's going on because it's pretty straightforward, all right? So basically, again, but let me show you where things are. The thing to remember with diagnosis of FIP with your relationship with your veterinarian or whoever is that you never depend on a single test, okay? That's the fallacy. You never, like, antibody test will get you in trouble. You cannot diagnose based on that single test. Most cats are exposed to enteric coronavirus, so they'll have a positive titer in some environments as high as 80 to 100%. So be careful. But what you need to do is actually all the information you have and compile it, and you can get an idea of this is high in your differential of a cat actually may have FIP or developed FIP, the history, young cat, maybe if it's a pure breed cat, that way, you know, it's in the back of your mind. There'll be changes in the blood work, in particular the albumin, the globulin ratio you look at, the high globulin levels you look at. Sometimes you'll have mild anemia. Microcytosis might be there. If it's the wet form, you'll have a lymphopenia. I mean, so there's some changes in the blood work that will be suggestive of FIP, where it puts it higher on your differential list, where it's likely to be the disease present. And then, you know, think about it. If you got a young cat and it's starting to present with progressive neurologic disease, you say, well, what can lead to progressive neurologic diseases? Well, that's usually infectious disease or cancer. Well, it's a young cat. Well, infectious disease goes way up on my differential. Well, that includes FIP, toxoplasma, and some other things. But the point is, there's a finite list of things that can do some of these, cause some of these things in a young cat. So now let's break this up in simple. Let's say the wet form. What about the wet form? You know, is that hard to diagnose? No, my opinion, it's not. I mean, you know, you look at it. The first thing you can do is get a little bit of that fluid, and you look at this fluid. Do what's called a Revolta test, and this is basically a little acetic acid. In my experience, you don't have to be so exact, 98% acetic acid mixed, you know, or vinegar, or whatever. You don't have to be so exact. The point is, it's pretty clear you get that sticky fluid, fibrin, high fibrin in that fluid, probably middle protein in that fluid, low cellular content in that fluid. And if you put a drop on top of the vinegar, dilute vinegar, and it stays together like this, this is a positive test. And it has pretty good high sensitivity specificity to confirm that you're dealing with a kitten, if you know, fits all the other criteria, that this kitten likely has FIP. You can see some people say, oh, you still need to do some kind of PCR analysis on this. And my experience is, okay, here I have a kitty that has a belly full of fluid. It's like 3 months old. It's positive on the Revolta test. What else can do this? I mean, think about what else can do this. Nothing good, right? Nothing good. It could be something like bacterial peritonitis. Well, bad. That's like a ruptured gut or something, or a migrating foreign body that brought in an infection or something. Actinomyces, or who knows, something yucky. Biliary carcinoma. Well, it's a young cat. Cancer. Well, it's possible, but that's, you know, that's still a bad thing if that's what it is. Lymphoma. Well, that's possible. Again, a young cat. That's not a common thing, but it could be. All bad things. All right. But those things, in my opinion, if you just put a, you know, spin this down, look at the cells under a microscope, you can rule those out like that. You just rule them out. Lymphocytes, lymphoma, or something else, carcinoma, epithelial cells. If you see the non-toxic pyogranulomatous, which means macrophages, a few macrophages, some neutrophils, you don't see bacteria, you don't see toxic neutrophils, well, that's, again, you pretty confident you diagnosed the wet form FIP in this kitten, okay, or cat. Okay, so the dry form's a little bit more difficult, or can be, but nevertheless, I mean, here what I want to focus in, I mean, you know, you can, I'm going to, let me go to this reference. You might be able to look up this reference. It might be available online or not, but Dr. Hartman, Katrina Hartman and Sandra Feldman, I like this reference. It just came out. What I like about it is they went through every single test available and have tables for the sensitivity specificity for each of these tests. So you need to know the value of a test, the limitations of the test, the sensitivity specificity of these tests, and then you can know how to use them when you're trying to make a more definitive diagnosis of FIP. Things have not changed as far as the gold standard, which is immunochemistry staining of tissue, or you know, the diagnosed FIP, which is usually post-mortem. That still hasn't changed, but now we're getting even better at really getting closer to that definitive diagnosis. Let's just go on this, I guess this would be on your right side. Cats with non-specific signs. Remember when it shows this, and this is in her table from her paper, that there was a lot done beforehand. You know, the signalment, the history, the blood work, etc. So now you got FIP on the differential, non-specific signs. So now you can go down this list. I mean, she jumps straight to the reverse transcriptase PCR, but if you look at this paper, you'll see the poor sensitivity in a lot of these tests. You want a high specificity so you don't diagnose this wrongly. But you'll look at these tests and you can get a host of different samples. And if you get any one of these positive, that's very, again, suggestive that you got a positive diagnosis, where there's an aqueous humor and a uveitis cats, CSF and a cat with neurological signs, etc. So you can follow this really straightforward. And what I like, I mean, you'll look in this reference too, and she has is a review. So you'll have other references in there about like isolating the large lymph node in the belly and actually doing cytology on that and running the RT-PCR right here on a lymph node. Do you even have, yeah, mesenteric lymph nodes. That's shown to be more sensitive, specific than you would have thought. So there's things we can do that are a little bit aggressive, but still not crazy and aggressive, like opening up, getting major biopsies, etc. So anyways, I think that's all I had. Sorry for bending your ear. I know I sort of was a little long-winded there, but I hope that was informative. So thank you for letting me talk.
It was super, Doc. I'm sure everybody who's watching will agree with me that you are really into understanding this and sharing that understanding with the rest of us, because there is a lot to understand about FIP.
There is, there really is. Yeah, yeah. Thank you.
I was a couple of interesting facts based on what you mentioned. The coronavirus, feline infectious coronavirus, is 29,000 megabases of RNA. Just for all of our cat fanciers out there, the FGFR5, the fibroblast growth factor 5 that creates the various long hairs that we see in cats, those alleles are only 10 megabases. So just 10 megabases can make a cat long hair, but it takes 29,000 to create feline coronavirus. It's just
one of the largest viruses in nature. Just something to remember, the coronaviruses.
Well, thank you so much, Dr. Ola.
Yeah, thank you. Yeah. Yeah. Now
we are moving forward, and we have a quick update for you. So far in matching funds, $2,011 has been raised in the past however long Dr. Ola has been speaking, and it was fantastic. So thank you to everybody who has donated. I wanted to remind you that we are recording this session so that you can go back and refer to it later, watch it again and again, because it's cool stuff, right? And there will be 2 emails that you'll receive. One immediately after this is done with a survey, and a follow-up email tomorrow that will have a certificate with CE credits and the race credits for continuing education. Now, you guys have the pleasure of hearing from a hero of mine. She was the woman responsible for introducing me to the Winn Feline Foundation. Dr. Vicki Thayer joins us to tell us what's going on with treatment in FIP. Dr. Thayer?
Well, thank you, Anthony. Virtual fist bump from here. So have a lot of information to cover. So we're going to rock and roll on this. I want to say hello to fellow cat lovers and thank you to Dr. Elsie and Tika and CFA being part of this webinar. And in this age of FIP, what about treatment? And I'm going to follow with managing multi-cat environments. So after so many years, an exciting and main advance is that FIP is now treatable for so many more cats. An accurate diagnosis and starting treatment as soon as possible are paramount to giving any cat with FIP the best chance to live and be cured. And this is a main statement from Susan Gingrich, the Brio Fund founder, and such a huge fundraiser for FIP research. So don't delay to start treatment when a presumptive diagnosis has been made. There are only two ways cats are diagnosed with FIP that can be cured. You find a way to stimulate a protective immune response, or you completely inhibit FIPV replication long enough to clear the virus from macrophages and or to allow host immunity to develop. Supportive care is much of what we've had to use in the past to treat cats with FIP. And now the main goal is comfort care and to sustain life, hoping some cats have some degree of a functioning immune system to control the virus and manage symptoms to recover, prior to potentially starting some form of treatment. Up to 5% of cats treated in this manner will survive up to 1 year. Nutrition and appetite are so important. Cats are carnivores, as we know, and they need protein in their diet, and this should be good quality animal protein. Yet due to the immune effects of the virus and the presence of periodic fevers, many cats don't eat well. Finding a food that they will eat is important. Appetite stimulants like mirtazapine or cyproheptadine can be tried, and mirtazapine can control nausea at the same time. Fluid support is also important, and the loss of appetite, a fever, or development of effusions can lead to dehydration. Using subcutaneous fluids at home, demonstrated with the image on the slide, or IV fluids in the hospital can help a cat to feel better. If they're still eating, hydration will likely occur to some degree due to food intake, especially with canned food. Controlling inflammation is also important. Prednisolone can be used, particularly at the start of treatments, to control inflammation, and it may help some cats to feel better and eat better. And it's recommended to wean off prednisolone slowly once the cat is improving with some form of antiviral therapy. Draining effusions also can be important. You remove pleural effusion to help cats breathe better, and also remove abdominal effusion to decrease abdominal discomfort. And this helps also to manage pain and discomfort for the cats. And such medications such as buprenorphine can be used to control pain due to inflammation and the presence of effusions. And gabapentin is oftentimes used to manage anxiety during treatment times. Antibiotics are also used. Probably the primary one is doxycycline. There is some thought that doxycycline has antiviral properties, and I think this is going to be explored more in the future as far as an evidence-based manner. There is a regimen out there to give doxycycline at 1/2 the normal dose along with prednisolone to treat cats, and sometimes to do this before maybe using some other form of treatment. And I have heard anecdotal reports that there are some cats that have recovered from FIP with this regimen. Immunostimulants are also looked at. Feline interferon Omega, there are reports that some cats have responded to treatment with this medication, yet overall, it's not been an effective therapy for large numbers of cats. Polyprenol immunostimulant is a medication that's been used to treat upper respiratory infections. Dr. Alejandra of University of Tennessee did a study in 2010 with PI on dry FIP cases. He felt that in a number of these cases, the cats felt better. He also stated at the symposium that there was an 8% effective treatment rate with PI used alone, and less if it's given with prednisolone. It must be given continually over time, as you would with other chronic illnesses. And there are cats out there who have been survivors from having FIP for several years who were treated with PI. Non-specific antivirals are also being looked at. Itraconazole, cyclosporin, chloroquine, and other antibiotics like azithromycin or the Z-Pak that they talk about nowadays, that has been mentioned as potentially another antibiotic having antiviral properties, and many other plant extracts. The issue is a lot of these other non-specific treatments have to be given at such a higher dose that they're at toxic levels to be effective. Mefloquine is an antiviral drug that is being studied at the University of Sydney in Australia, and there has been 2 prior studies in vitro in the laboratory to look at safety and efficacy of this particular medication. And it's now at the start of a clinical trial phase. And it's very much in the same relationship as the hydroxychloroquine that's been mentioned as a adjunct treatment for COVID-19. The big thing on the block right now are antiviral drugs, and specifically targeting viral proteins. Antivive Life Sciences is working to gain FDA approval of GC376 that Glenn mentioned earlier as a treatment for FIP. The image up in the right-hand corner is of a molecular structure of GC376. And in the study, the clinical trial that was done with GC376, it appeared to work better against wet FIP cases versus dry forms. There was a concern that did it reach efficacious levels enough to cross the blood-brain barrier for a neurologic form of FIP. This is one of the well-known survivors from the GC376 study at UC Davis, and this is Smokey, and he belongs with Peter Cohen of Send by Cats. Peter is also a huge fundraiser and for research on FIP, and Smokey is doing great. He's definitely a gorgeous cat, and Peter's an awesome guy. This is definitely the one big cat on the block that we've been, evaluating and looking at in the last year or so, GS441524. And again, it was also developed or looked at by Dr. Nils Peterson and Dr. Brian Murphy at UC Davis. It's an RNA transcription inhibitor, and it is produced by Gilead Sciences, which unfortunately, it's under patent by Gilead, and they're not making this particular compound available for veterinary use. So therefore, that's where we go into a lot of the issues and controversies about the use of this particular drug or chemical for FIP. Remdesivir is, the image is on the right in the upper right-hand corner. That's GS5734. And this is really right now the hot drug or hot topic because they're just potentially going to release an emergency for trial or use in humans for COVID-19. And actually, Dr. Peterson has found that this is the prodrug, the predecessor for GS441524, and GS441524 is actually the active ingredient. This is, these are some images of Luna, Savannah, who belongs to Deb Roberts. And Luna is also one of the well-known survivors from the GS441524 clinical trial with Dr. Peterson. On the left is Luna when she was around the time she was diagnosed. And on the right is one of my favorite pictures of her leaping into the future post-treatment, where she was doing well. She had had wet FIP, and it was amazing how fast she had responded. And like I say, she's doing great. She lives with 3 other Savannahs, no relapse, and the other 3 Savannahs are doing well. And Deb has a wonderful blog that oftentimes we'll talk about FIP. Great one to read. FIP is now considered a curable disease, and reports of cats being treated and cured. Dr. Peterson at the symposium commented that 3,000, potentially several thousand more cats have been treated worldwide with a version of GS and anecdotally responded. More cats are expected to come along to take the place of the ones that have responded, and these cats are needing treatment. What's the definition of a cure? I think we don't have one yet, and that's oftentimes been debated or discussed between myself and other clinicians and cat lovers. And so I think we don't have a definition yet. We don't know, again, but Smokey and Luna are 2+ years out from treatment, and they're doing quite well. And I know, speaking with Dr. Peterson, he feels that they're both likely cured. We don't know if they're immune to reinfection, but he doesn't expect that that's likely. The timeline for reversal of signs for both wet and dry forms of FIP can be days to weeks, depending on the form. Wet FIP will essentially respond within days, and the dry FIP probably, especially if they take longer to start treatment, can take weeks to respond potentially, but the cats oftentimes start feeling better and doing quite nicely. As far as potential resistance to these antiviral drugs, all the researchers at the symposium said there will be resistance developed to antiviral drugs. This is one reason that they're working to develop additional antiviral drugs. HIV right now oftentimes uses 3 drugs to treat. And if one doesn't work, the next might. And if 2 drugs aren't effective, then the 3rd likely will. And you can see in the image on the left is much like Dr. Ola's slide earlier, showing different target areas and spots where different antiviral medications can work. About 3% of cats treated with a version of GS are naturally resistant to treatment with the drug, according to the study done by Dr. Peterson. This slide describes Ridley. Ridley is a patient of a good friend and veteran colleague of mine in California, and he was diagnosed in February. His main problems coming in were bilateral conjunctivitis and pleural effusion, poor doer. And his weight was 6.1 pounds. He had a fever. He was anemic. His white blood cell count was elevated. His total protein was 13.3, which I'd go, wow. And his AG ratio was 0.2, which is quite low. Ridley started on an oral capsule form version of GS on Valentine's Day, and his latest lab work from April 7th is Ridley's up to 10.6 pounds. He's not anemic. His white blood cell count is normal. Total protein's up in normal range, 7.8, and his AG ratio has increased to 0.65. And you can see Ridley really looks pretty much like a normal cat. The X-ray down below demonstrates the pleural effusion that was present. And certainly his human, from what I hear, is very pleased with how he's doing. And I know my veterinary colleague is amazed to see how well Ridley's doing as a patient. With non-FDA approved treatments, what's the role of the veterinarian in this situation? Because these antivirals are not approved by the FDA, they cannot be prescribed, purchased, and dispensed by veterinarians. Many veterinarians choose to offer care and treatment support to cats with FIP. Others choose not to because of stringent state practice acts covering the use of non-FDA approved drugs, essentially illegal, under our Veterinary Practice Act laws. We do recommend that people establish a VCP relationship, and that's veterinary client-patient relationship, because veterinarians do want the best for their cat patients, and it helps to go through a serious and life-threatening illness with a veterinarian or support with that you trust. There are only 2 peer-reviewed and published studies currently on antiviral treatments, and primarily on the wet form of FIP and not on dry FIP. Both have Dr. Niels Petersen as one of the authors. You'll see the abstract for one on the right about GS 441524. Their PubMed info and internet link is in the summary document that you receive. Unfortunately, there's no centralized scientific database being maintained on cats treated for FIP. We're not capturing the valuable case and treatment data due to a lack of a central data depository like the NIH, CDC, or Johns Hopkins that they have in the human side. So, I think it's really important that we need to learn from our successes as far as treatment and our failures, which cats may not respond in the course of this disease treatment. Versions of GS 441524, labeled as dietary or nutritional supplement, are acquired through online or non-veterinary sources. One such place is FIP Warriors on Facebook. It's the largest online group supporting antiviral treatment and helping others find these resources. Their Facebook link is found in our summary document or by searching on Facebook. The sources for GS 441524 can be found through, like, say, FIP Warriors or the companies from primarily China making the compounds. Methods for treating the wet and dry forms of FIP, primarily the treatment is with oral capsules or by injection for 84 days, with a following period of 84 days being disease to state that the patient is cured. The dosage to treat the ocular and neurologic forms of the disease is twice the milligram dosage per kilogram used for treating the wet form. The medication's cost is based on weight and can be purchased in stages if needed, since it can be quite expensive. One of the key statements from our symposium came from Dr. Brian Murphy. This is a treatable disease. We will cure this disease. We basically have the cure now. It's just a matter of finding the exact right drug and the right combination of drugs, and then making those available at an affordable price. As with the current pandemic of human COVID-19, cat lovers are all in this. Together, we will defeat FIP. Now I'm going to go on and talk about managing multi-cat environments such as shelters, rescues, and catteries. And one of the key statement Dr. Peterson had in a recent journal article is, what's the best way to care for kittens in catteries, shelters, and rescues to minimize FIP losses? Because I know this is an area he feels that the largest number of cats develop FIP and are the most vulnerable. In shelters, FACV exposure and FIP case numbers, a 2004 study by Dr. Peterson and Dr. Janet Foley found FECV shedding increased 10,000 to 1 million fold in shelter cats. So more than 50% of cats that came into a shelter that were negative for FECV were positive within 7 days. We found, through getting ready for our symposium and during our roundtables, that well-managed shelters with appropriate infectious disease control are truly not seeing a problem with FIP cases in their shelters or in cats post-adoption. The FIP rate should be less than 1% or not more than 10 cases of FIP in 1,000 cats. Infectious disease control should include environmental enrichment and looking at housing needs. Shelter studies have shown that a double compartment enclosure with at least 8.5 square feet of floor space leads to a 50% decrease in upper respiratory infections. Adding a portal, an opening with a cover between compartments, decreased respiratory disease 90%. And if you control upper respiratory infections, it's a great way to help control other infectious disease spread, like with FIP. Fostering programs are also important, and they lead to increased live release rate in foster kittens and cats outside the shelter in well-managed foster homes. We had a description at the symposium of kittens from Placer County, California, where they have neonates that are fostered outside the shelter. They don't come into the shelter until they're spayed and neutered, vaccinated, and then adopted out, and they're not exposed to infectious disease. And they've dropped their loss of kittens down to pretty much 0%. And there also was another description of Don't Kidnap the Kittens program, where if you find a litter of kittens outdoors and you don't see the queen, leave them there, because the queen is probably off hunting or not present, and they can be gone for hours, but they will return. You can monitor the situation, but don't pick up the kittens and bring them to the shelter where they're exposed to infectious disease. They're usually better off in their own environment. With cat group logistics, it's recommended you don't mix age groups. Keep the group small. Kittens, as far as, having them similar ages together and not with adult cats. The adult cats are kept separate. You also look at the length of stay. You don't mix short stay, 3 weeks or less, on cats that will be adopted out, with long stay groups of cats that are there for weeks to months. There's more disease spread, and cats do they found individual housing better than group housing, and they do better at it with this. There was also mentioned that early spay and neuter is now recommended at 1.5 pounds, which is often 8 weeks of age for these kittens, and the shelter medicists have found that they have done thousands of these procedures with no problem. This is an image from Correct Shelter Medicine Program and their DIY housing handout. You should have a link toward that in the document, and you can look on their website. And it shows low stress cat housing, the double enclosure, the portal, covered portal. This is where cats can eat and sleep and on one side and have their litter box on the other. You don't disturb them when you're trying to clean the litter box and, you know, share infectious disease material. And this is found to work so much better for many of these cats. And it's not just for shelters. I think it can work for catteries, in veterinary hospitals. So keep in mind, you know, that this sort of setup can be very beneficial. And there's a link at the bottom on where you can order the pet portals from the Correct Shelter Medicine Program. With rescues, this is the most affected multi-cat group as far as Dr. Peterson is concerned. They have so much more as far as large numbers of FIP developing in the kittens and cats. There's a need for infectious disease control protocols here and more study, more research on what the factors are that make this such a significant issue. They need tools. They need more tools to control infectious disease spread, and that oftentimes means more financial and people resources. And also there are mentoring programs out there that many shelters offer, and these oftentimes can give guidance on how to foster kittens and cats and increase the adoption rates of the cats, in, you know, getting them into their forever homes much quicker. And with TNR programs, consistent programs work better, as a number of shelters commented at the symposium that they would trap and perform their spay, neuter, and other medical procedures on the community cats, and then return the cats to their own environment or location the cats knew. And they found over time the cats were healthier and did better. Sanctuaries are another stripe of kitty, and that's if a rescue or a shelter decides to be a cat sanctuary, and that means fewer cats coming in, fewer of them being adopted out. They should focus on that role and not mix being a form of a shelter where cats and kittens are intermingled by age and time of stay, as I described before, because this increases the chance for infectious disease spread with more virus exposure over time to vulnerable cats. With catteries, elimination of FECV and FIP from a cattery really requires total elimination of the virus, which at this time cannot be effectively accomplished since FECV is ubiquitous in nature. Anytime a cat goes out to a cat show or another cattery, they are likely to be exposed, or the virus can be brought in by people to the cattery on fomites, which would be clothes or carriers or other moving surfaces. Plus, immunity to FECV is not long-term, so re-exposure certainly can occur. Infectious disease control uses the same concept as mentioned earlier with shelters, and this I think can work for catteries too. Certainly not mixing queens with their litters with other adult cats in the household. And breeding cats in FIP, it's stated that pedigreed cats are 3 times more susceptible to FIP. We certainly need to know more in this area. And Dr. Peterson advises that in purebred cats, if they produce kittens over time that develop FIP, to not breed them in the future. And he also had stated, in addition, not to breed any cats that have gone through the antiviral treatment and survived. Thank you. And I'd like just lastly to put in a plug for those of you here to subscribe to Winn's Cat Health news blog on the website under education, then Cat Health news blog. Certainly, this is where we tell about grant progress reports and peer-reviewed articles, summaries. And this week, there'll be 2 on FIP by researchers who were at our symposium, and it's great information for you to learn about cats and their health. So thank you again.
Thank you, Dr. Thayer. That was fantastic.
Fist bump.
Fist bump. All right, a lot of good information. I want to give a couple quick updates. As I say thank you, we are at $2,200 in our matching donations over the course of our presentation. So if you want to text CATS to 833-985-2287 and show Dr. Thayer how great she was and how how good they were and how much you're anticipating Dr. Drew Wagner, please do that. Now, hey, are you still there? I have a quick question for you. I want to know, who is everybody out there? I have a quick poll. Please answer right on your computer or your phone, however you're listening. Are you a veterinarian? Are you a cat enthusiast, a breeder? Do you show cats? Are you a rescue? Do you foster cats? Please tell us what best identifies you. It'll only take 15 seconds of your life. And while you're doing that, I'll again thank Dr. Thayer, Dr. Ola, and Dr. Wagner, who's coming up, all our good friends at Dr. Elsie's, Tika, the International Cat Association, Vicki Fisher, and Ralph Statter, Liz Hanson Brown, and Vicki Joe Harrison, and all the whole great board of directors, all those good folks at CFA, Mark Hannon, and Daryl Newkirk, and Teresa Kiger, and Carla Bazell, and all those other cool folks I'm forgetting. Answer the question now. You've got just a few minutes, or seconds. And organizers and panelists don't get to vote. Now, when Dr. Thayer was showing that low-stress cat housing, all I could think of was that it was bigger than my dorm in college, and it was kind of the same design, actually. We had a bed on one side, a wall, and it was kind of a hole. I guess you could call it a doorway, but a portal certainly sounds better. You've got just a few seconds left to vote in the poll of which best identifies you. Now, as we bring this poll to a close shortly, and in just a few quick seconds, we are going to talk to Dr. Wagner about what's next as we pursue FIP, and it seems like we won. You know, curable is just amazing. Thank you, Dr. Thayer. I mean, it's amazing that FIP is curable, but we know their costs to curable. Unfortunately, treatment didn't come for free. It's not free. And the research that created that treatment didn't come for free. It took a lot of donations, and we appreciate all of you guys who have donated today. But what about prevention? An ounce of prevention, they say, is worth a pound of cure. So Dr. Drew, tell us what's next and how we go about preventing FIP in the first place.
Thank you very much, Anthony. I appreciate it. Anthony is one of our board members as well, which is why we keep him on, because he's such a good moderator and does a great job with this. I did want to point out, though, that our goal for fundraising is $5,000. We don't want to leave this on the table. Since it's matched, it automatically doubles your donation up to $5,000. If we don't hit the $5,000, we obviously won't have the match either. So your donations are very much appreciated. I also wanted to mention that the document that we keep referring to, the summary document from the FIP Symposium at the University of California, Davis last November, which is basically where all this came from, is available on the window that's showing up on the right of your screen as a handout. You can download that directly. It's also on our website. And as Anthony mentioned, we'll be including a recording of this video as well on the website after the program. So this will be very much available to all of you. And also, if you have questions, we probably won't have time for them on this seminar itself, but there is a website where you can post questions and we will answer them for you. So it's my job to talk about prevention and where we're going with all of this, because the future of FIP is happening as we speak. As you know, the excitement is treatments that are available for FIP now that are also being used for many coronaviruses, including COVID-19. And so, you know, we're very much at the cutting edge of veterinary medicine, which is where Winn has always been. So treatment is the thing now. It's the big news, and it gives us possibilities we never had before. It turned a 100% fatal disease into something that is now treatable and possibly even curable. But when you think about it, although treatment is a good goal and it's where we are now, it's prevention that really will make a difference. If we can prevent FIP, we don't have to worry about treatment. These cats don't have to undergo needless illness and morbidity and even mortality. So when you're talking about prevention of any disease, it takes several things to reach this goal. We've already talked about diagnostic test and the therapeutic treatment. I'm going to talk a little bit more about environmental control plan that Dr. Thayer initiated, and we'll talk about where we're going with a vaccine, because that's really going to be the big news should we ever get there. So to continue with the environmental control subject that Dr. Thayer introduced, she mentioned a few of these as well that are very important when you're again talking about controlling any disease, and then of course particularly FIP. Avoiding stress is a big factor because a cat or any other patient that's stressed, their immune system is not functioning as well. They're going to be shedding more virus and contaminating the environment more. Overcrowding will not only contaminate the environment, but it will also increase the mutations of this virus. As Dr. Ola mentioned, this is a very large, very complex virus and mutates quite easily. Avoiding comorbid conditions, things that go along with illness, like poor nutrition, a lack of passive immunity, which our fanciers will know as colostrum, is nursing right after birth, and gastrointestinal dysbiosis, which essentially is a fancy word for diarrhea. But to have an environment that is totally free of coronaviruses, as Dr. Thayer mentioned, is pretty much not practical because it's so easy to get reinfected and the virus sheds intermittently. And so you can work quite diligently at keeping the environment as clean as possible, and you should. But it is hardly worthwhile to get to the point where you think there is just no coronavirus there. It will happen so easily. There's also something that's very interesting that's come up with in the last year, and that's the role of cat litters. The study by Dr. Diane Addy showed that a bentonite-based cat litter, which Dr. Elsie's manufactures, decreased environmental transmission compared to other litter types quite significantly. Dr. Elsie's is one of the few cat litter companies that's put forth any research on cat litter. And they're to be applauded for this, because this will make a difference in controlling the feline coronaviruses in general, and FIP in particular. This is a picture of Dr. Niels Petersen. Should you ever wonder who he is, he was speaking at our seminar, and he's been working on FIP research since he was a student. And is now Professor Emeritus at the University of California, Davis. And this is him speaking at the seminar that we held back in November, and a couple of quotes for him. One of the audience members, one of our board members, George Eigenhauser, asked a question as a fancier about early weaning of cats to control coronaviruses. And that does seem to be something that can be effective if it's done properly. You can see from the notes that there's two forms of passive immunity. The colostrum is what they're nursing right after they are born, and really only absorbs for about the first several hours to a day or so. But passive local immunity, as long as they're nursing, they're getting something called lactogenic immunity. These are different immunoglobulins that can help control many diseases, including FIP. So his proposition was to wean them early and quarantine them. Now, that has to be done fairly early, and it has to be done in a very clean environment, of course. And you also do potentially have the issue of social integration and lack of social integration in kittens that are separated from their moms. But another option would be to test the queen for viral shedding. And if she's negative, to quarantine the queen before she gives birth, and then keep them separate until they're older, and then introduce them to the other cats. Of course, they'll get exposed, but at that point, they're older and they've got a much better immune system, so their immunity should increase significantly. Unfortunately, we have a problem with coronavirus immunity. It isn't permanent, although you get initially a very strong immune response, which can cause some of the disease. The immunity does wane over time, and so it is possible to get reinfected with coronaviruses multiple times. There is some indication that the COVID-19 virus will do the same thing in people. The passive immunity, as we just talked about, is highly protective, which we'll talk about when we talk about vaccines, but it also is temporary. And so unfortunately, it just doesn't induce durable immunity. But perhaps there's a way of inducing an innate cellular immunity, which is what they need for permanent immunity, that could be vaccine induced. There's another factor here, and something that many people have suspected, whether some cats are genetically susceptible to feline coronavirus in general and FIP in particular. Because when you think about it, only 11% of coronavirus exposed cats get FIP, and of those, very few of them become symptomatic. The initial impressions, it does not appear that individual breeds are more susceptible, but lineages within breeds are. Now, that could be significant when you're talking about a breed such as Burmans that are not very genetically diverse. There are very few lineages in Burman cats. And so if some of those are susceptible to FIP, then that may be the majority of the breed. But if you think about it from the logical standpoint, if some are more susceptible, then some must be genetically resistant. So chances are there is some genetic resistance to FIP. But Dr. Lyons, who also spoke at our seminar, says they really don't know anything about the genetics of FIP at this point. And there may be a whole set of genes that could be involved in response to drugs and treatment, as well as vaccines. So this is a wide open field right now. And there hasn't been a lot of research going on in this, although what has been done right now has been funded by the Winn Feline Foundation. Dr. Lyons is one of our rock stars, so she does quite a bit of research involving grants from the Winn Feline Foundation. If anybody can figure it out, she can. Again, this issue with vaccinations. I know you know there have been vaccines in the past for FIP. There is currently a FIP vaccine on the market that is not very effective. But one of the reasons that there isn't a good vaccine right now is because of the previous vaccine failures. When you're talking about getting an immune response to FIP, it's all or nothing. Either you get a strong enough immune response to get rid of the virus entirely, or if you don't, the antibodies that you have are probably going to make you worse. And so that is an issue when you're talking about developing a vaccine. We'll talk about some ways of looking into this particular aspect of it. Something that Dr. Ola mentioned is our current vaccine is against the serotype 2, which is an Asian version of FIP, not seen very frequently in this country. In this country, we have primarily serotype 1, but you can't culture it very easily. In fact, it's almost impossible to culture. And until you solve that problem, it's going to be pretty difficult to come up with a vaccine against serotype 1, which is what we need. And then again, we alluded to the genetics of the response to vaccines in cats. So one of the ways of looking at this is maybe we work backwards. If we understand how the immune response works and how we get a very good neutralizing antibody response, in other words, enough antibodies to get rid of the virus, to neutralize it entirely, then we can maybe figure out how to develop the vaccine. As I just mentioned, you have to be able to culture serotype 1, and so that's coming. We're working on that too. I mentioned serotype 2 as being the Asian variety. That doesn't occur here. However, its incidence is increasing because we are bringing lineages from Asia and other countries into this country to breed with our cats in order to increase the genetic diversity. It is a goal to have a genetically diverse breed, because then there's more resistant to infection in any case. But by doing that, you are then introducing another serotype into this country that has to be dealt with. And then something we're going to talk about in a minute is targeting stalk instead of spike proteins as a method of coming up with a vaccine. I don't know if there's anybody on this planet who has not seen this schematic. This is a drawing of coronaviruses, and it does illustrate, as you can see, the spikes that are on this virus. But this is just a drawing, and Dr. Ola had a similar picture a minute ago showing the spikes that are on this this virus, and we'll see if this works. There we go. Here's a coronavirus, one coronavirus. There are the spikes. You can see them on the edges of this electron micrograph. They're all over the place. There's a spike they're looking right down the top of. These are spikes all around this virus. And these spikes are what attaches to the cells in the intestinal tract to infect a cat. And so if you look then at these particular spikes, each spike, and here's a spike right here, right now, there are 3 of these. But if you take the three of these trimers out into one monomer, it looks like this. It's sort of like the stalk here with the branches of the tree. The spike is up here. So these are the areas, these are the parts of the virus that attach to the cell, and that's where current vaccines are directed against, which makes sense. However, these vary tremendously from one coronavirus strain to another. Remember, coronaviruses mutate, so here's where you get the most variability. You get the least variability in the stalk, which is right here. So if you direct the vaccine against the stalk, these don't vary much from coronavirus to coronavirus, and so you're going to be able to get much more effective vaccine if you target this as opposed to targeting the spike itself. Gary Whitaker spoke as well. You're going to see almost all of them, all the important ones anyway. And these are quotes from him while he was talking at the symposium in November. About people being scared of making a vaccine and the fact that you are not getting a very strong neutralizing response. You need to get that in order for a vaccine to work. And going for the stalk, if we can do that, then you're going to get a much more effective vaccine that is effective against many more coronaviruses. And then the other way is the conventional way of attenuating or making a vaccine either with a killed virus or a virus that has been modified so it's not pathogenic. That's the current technology to see if that can give you better immunity. Again, you have to get this to work properly or you're just going to make the disease worse. So the role, if you think about it, what does everybody want? They want one shot that gives them immunity for the rest of their lives. That's not necessarily practical because that's the ideal perhaps, but it's not likely you're going to hit that ideal at least initially and maybe not ever. So perhaps it's better to tailor it for its use. You might need a very strong, rapidly effective vaccine that doesn't last very long if you're just talking about protecting cats that are coming in and then leaving shelters. They may only need this immunity for a month or 2 while they're in the shelter, where you might need longer immunity for catteries, where you have cats that live there virtually all their lives. And this idea that maternal immunity produces excellent protection is a key, because if you can get good immunity, we're talking about enough antibodies. If you can get this to happen, you can prevent this disease. If you can't, you'll make it worse. Greg Dean, guess what? He spoke at the Symposium. He's the last one. Again, this just gives you some idea of what went on at the Symposium, because it was really quite an amazing amount of knowledge that got shared there. And he was the one that proposed that maybe you don't need a vaccine that will protect you for the rest of your life, but one that will actually give you immunity for a shorter period of time. if that's the type of environment that the patient is in. So I did want to talk briefly about the Winn Feline Foundation because most of you know about us. And those that don't, we were actually established by the Cat Dancers Association, one of our sponsors, as a committee, as a matter of fact. In 1968, we became the foundation shortly after that. The very first grant that this committee awarded was for FIP back in 1971. And so here we are, 49 years later, almost half a century. We're still funding FIP grants. To date, we funded 800,000 or more. And that's out of $7 million in total grants that the Winn Feline Foundation has granted over its 52 years. This foundation is responsible for some of the most cutting edge medicine for cats that's ever been produced. We've funded studies such as taurine, which solved the diseases like congestive cardiomyopathy, otherwise fatal heart disease in cats that basically is almost unheard of now. The diabetic diets that many of you use for your diabetic cats, that was originally funded for cats by the Winn Feline Foundation. Mirtazapine that Dr. Thayer mentioned as an appetite stimulant that many of you would have used, that was originally funded. Things like hypertension in cats, ultrasounds in cats, these were all done by the Winn Feline Foundation over its 52 years, and we'll be doing it for the next 52 years as well. The Brio Fund, which has been mentioned, was established by Susan Gingrich, who was a board member of ours for several years, and it was in memory of her Berman, Bria, who unfortunately died of FIP, and she promised that cat that she would cure FIP, not thinking that would happen in her lifetime, but she did it. We have a treatment for FIP, which we've never had before. And this has taken almost 50 years to get to this point. So it's quite a feather in Susan Gingrich's cap to get here. She's raised almost $700,000 in research specifically for FIP, and it's funded $500,000 of FIP grants to date. It's an ongoing fund. It's highly regarded. It's solely focused on solving FIP. And if you can, please give whatever you can to cats at 833-985-2287 to donate to the Brio Fund. I did want to talk about some of the recent FIP grants that we've awarded. This is all in the last 2 years, where we've funded things such as looking for diagnostic biomarkers, as Dr. Ola was talking about. The role of genetic differences, we're still working on this. There's something there. We just haven't found the key yet, but we will. The attenuated vaccine development, nucleoside analog therapies, that 70% effective is increased now to almost 100% effective with the newest antiviral drug, GS441524. There are other alternative treatments for FIP, and we will certainly need combined antiviral therapy because resistance is coming. Although the drug that we have right now works incredibly well, it probably won't work incredibly well for much longer because this drug mutates rapidly and we'll figure out a way to get resistant to it. So we'll need other antiviral drugs, and we're funding those studies as well. Where we're going, we need to know how infection leads to immunity in many cats, but only disease in a few. Why do only a few cats get FIP? What's the key here? That's going to be a active area of research, because we can figure this out. We can figure out where to focus our treatment dollars. Can this lead to an effective vaccine? It hasn't gotten to a good one yet, but we're working on that too. And there are probably better drugs. We've already found one. The GS drug is much better than the original antiviral drugs that we looked at. Can they synergize? They will synergize with each other to avoid resistance. And then what actually are the best practices for cat raised shelters and rescues? Because it's going to be different for every environment. I'll turn it back over to our moderator, Anthony, but thank you so much for your attention. Again, I know you have questions, so please send them to us and we'll be happy to answer them for you. Thank you so much.
Thank you, Dr. Drew Wagner, president of Winn Feline Foundation. That was fantastic. You're helping us keep kittens like this little guy in fostering from getting FIP, and we're really grateful to you, to Susan Gingrich, Peter Cohen, Deb Roberts, the boards of CFA, TICA, Dr. Elsie, oh my goodness, for helping us make sure cats like this, kittens anywhere, everywhere, every day, are helped by Winn Feline Foundation. I wanted to give you a quick estimate. Update, we have $2,800 in matching funds. So our donor will give us $2,800 of potentially $5,000. Come on, people, text CAT, CATS to 833-985-2287 and get this dough. So please help us support all the great research that we can to improve lives like this little guy that is hungry at the moment, so that we can help more cats. I wanted to also move on to our next slide, but let me tell you that to our poll question, 70% of you answered, 50% of you are breeders. Well, welcome you guys. So little kittens like this are no big deal. You see them all the time, but each one is special. 24% of you are vets, 18% are owners, and 6% of you are with rescue and shelters. 2% of you are with researchers, so apply for your Winn Feline Foundation grant if you can do something good for cats. Right now, okay, we're at $3,700, $3,770 right this moment. Give us more, give us more.
All right.
All 5,000 that we can get from you, and it'll be matched. I wanted to also thank the incredible FIP warriors, because this matters. Why does it matter? It matters to the lives of cats, to that incredible human cat bond that we all make. Unfortunately, too many cats have died before we knew that there were treatment, before it was discovered, before it was funded. Since the 50s, domestic cats and wild cats have been diagnosed with FIP. And this increases our scientific understanding so that we know that coronaviruses affect more than just cats. It was only fatal in cats up until this year. Now we know that it is far-reaching in its effect. The feedback and long-term effects of treatments that began first with cats will help us understand how coronavirus, when it attacks other species like humans, really has an effect on the long-term health of those animals and our people. And finally, the good thing about this part of Winn, all of our great board members, George and Vicki and Janet and all of you guys, this is a people and cat powered solution. You guys have done the work by giving us money. Text CATS to 833-985-2287. And we have done really rigorous reviews to make sure that the appropriate scientists get this money so they can find cures and insight to help us all. I'd like to thank our sponsors once again, the incredible staff of Winn Feline Foundation, Julie, Virginia, thank you, Lisa, where would we be without you? And our president, Dr. Drew. We love and appreciate all of your work. Thank you guys so much for joining us today. Don't forget, this recording is available. You can download the summary document so you can refer to this, hand it out to your vet, send us your questions, FIP@winnfelinefoundation.org, and we're going to answer every single one right after we feed this kitten. Feel free, we've got more money coming in. Yes, text CATS to 833-985-2287, but most important, love your cat, love every cat every day, and we can help them here at the Winn Feline Foundation. Thanks, Dr. Drew. Any last words?
Yes, I do have a last word. At that seminar that we held, it was amazing to get everybody together, not just researchers and veterinarians, cat owners, cat survivors, FIP warriors, shelters. It was an amazing event. And I think that exemplifies exactly what Dr. Thayer said earlier. Together, we can fight FIP.
It's my favorite use of Facebook ever. So please support Winn Feline Foundation, read this document, share the video. It'll be out tomorrow, and check your email. You've got a certificate coming. Thank you, guys. Bye-bye.
Bye-bye.
I'm gonna feed you, I promise. We'll get there. Oh.